The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Marife Aczon-Armstrong.
Aloha! Good evening. Magandang gabi po sa inyong lahat. Maayong gabi sa inyong tanan. Naimbaga Sardam. And thank you so much for joining us here at Healthy Mondays with Apina of Nevada. I'm yours truly, Dr. Marife Aczon-Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor in nursing at Roseman University of Health Sciences College of Nursing. Here we are again on a Monday night, and it just happened to be the day after Father's Day, year of 2022. So it's fitting that we celebrate post-Father's Day episode here on Healthy Mondays. And I'm sure that you are wondering, how did Father's Day come about? Because, you know, we have Girls' Day, we have National Siblings Day, National Boys' Day, and even all the different days, special days. So let's look at what Wikipedia say. So according to Wikipedia, Father's Day is a celebration honoring people's fathers and celebrating the fatherhood, paternal bonds, and the influence of fathers in their society. And in 1966, President Lyndon B. Johnson issued the first presidential proclamation honoring fathers, designating the third Sunday in June as Father's Day. 6 years later, the day was made permanent national holiday when President Richard Nixon signed it into law in 1972. So many history about Father's Day. According to the almanac.com, Father's Day celebrates and honors the men who have embraced the essential role of fatherhood. So on this day, Father's Day, we also thank fathers and father figures like uncles, grandfathers, for the sacrifices they make for embracing the responsibility and nurturing their raising children and for devotion to their family. Many countries also celebrate this holiday of Father's Day at other times of the year. In Australia, for example, Father's Day is held on the first Sunday of September. In Norway, Sweden, and Finland, it's on the second Sunday in November. And in some Catholic countries, it's on March 19th, which happened to be St. Joseph Day. So you may be wondering and asking yourself, who invented Father's Day? Well, according to my research, like Mother's Day, the modern American version of Father's Day has a history that goes well beyond greeting cards. The first known Father's Day service occurred in Fairmont, West Virginia on July 5th, 1908, after hundreds of men died in the worst mining accident in the U.S. history. The Sunday service happened because of efforts of person by the name of Grace Golden Clayton. And she is the daughter of a dedicated reverend. And while missing her own dad, who died in 1896, Mrs. Clayton wanted to honor the many fathers who had died in the mining explosion, which killed more than 360 men and boys and left about 1,000 children fatherless. And although the Fairmont service was the first known to honor fathers, it did not turn into an annual event, nor was the idea promoted. Because at the time, there was a large July 4th celebration in Fairmont, and there was a tragic young death from a typhoid fever that took over the news at the time. And several other people across the nation had similar ideas throughout the years, but this person named Mrs. Sonora Smart Dodd is credited for being the one to popularize Father's Day, starting events that led to Father's Day becoming a United States national holiday. Her story began as she sat listening to a Mother's Day sermon in 1909. And Mrs. Dodd thought that it might be nice to honor fathers as well. Her father, William Smart, had raised his 6 children alone on his farm in Washington after his wife died giving birth. And Mrs. Dodd proposed to the Spokane Ministerial Association and YMCA that they celebrate a Father's Day. She chose the 5th of June because it was her father's birthday. The idea received a strong support, but the good ministers of Spokane asked that the day be changed to give them extra time to prepare sermons on the unexplored subject of fathers. And the first Father's Day in Spokane, Washington was observed on June 19th, 1910. And it was the third Sunday in June, and it became an annual event there. Soon, other towns had their own celebrations. And in spite of the widespread support, Father's Day did not become a permanent national holiday for many years. The first bill that was introduced in Congress in 1913 regarding making Father's Day a holiday, national holiday. And in spite of encouragement by President Woodrow Wilson, it did not pass. But in 1966, Lyndon Johnson issued a proclamation designating the third Sunday in June to honor fathers. Finally, in 1972, President Richard Nixon signed a law declaring that Father's Day be celebrated annually on the third Sunday in June. And since then, it has been an official, permanent national holiday ever since. So, and there you have it, the history about Father's Day, since yesterday was Father's Day. So, belated Happy Father's Day to everyone, all the dads out there. And now, June is actually the Men's Health Awareness Month. And so now that we have acknowledged our men in our lives, let's celebrate the month of June as Men's Health Awareness Month. And according to the National Center for Complementary and Integrative Health, some health issues such as erectile dysfunction or ED and prostate problems are unique to men. And as many as 30 million American men have erectile dysfunction and benign prostatic hyperplasia, and the most common prostate problem for men older than age 50. And other health issues such as coronary heart disease, lung cancer, HIV infection, and Parkinson's disease are more common in men than women. And some dietary supplements are marketed specifically for men's health issues, but many have not really been shown to be safe and effective. So all you guys out there, be careful of what you take and according to the market. So research them very well. For instance, no complementary health approach has been shown to be safe and effective for treating erectile dysfunction. So scientific evidence also does not support using dietary supplement such as palmetto for any health condition. And yet it is often promoted for urinary symptoms associated with an enlarged prostate gland. And similarly, there is insufficient evidence to support the use of dietary supplement lycopene for preventing or treating an enlarged prostate gland. So beware and do your research. Let's go into what are the common male diseases. In my research, it says that there are 8 common men's health to watch out for. So listen carefully. Heart disease is the top of the list. More men die of heart disease than any other cause of death. Cancer is next, and cancer follows heart disease as the second leading cause of death among American men, according to the Center for Disease, CDC, Center for Disease and Diabetes is next. Again, erectile dysfunction, HPV, and other sexually transmitted infections. Low testosterone is another one. Depression, and of course, COVID-19. So from an evidence-based peer-reviewed article that I looked at titled Men's Health, What Should We Know? And this is authored by Se Wong Kim, published in the World Journal of Men's Health. And author Kim said globally, the average male lifespan is 4 or 5 years shorter than female lifespan. And this discrepancy is approximately 7 years from Korean males. And I think Kim is Korean and did a research study on the Korean male population. Males have been found to have higher mortality rates than females from the embryo stage to old age. And this discrepancy is generally attributed, listen carefully, men out there, to lifestyle-related health problems in youth, as well as a relatively high incidence of cardiovascular disease and malignant tumors after middle age. And there's another research study by Pinkhak Sov and his colleagues comparing the differences between men and women regarding 15 major causes of death based on an analysis of medical statistics from the USA. And they found higher mortality rates among men for 12 diseases and identified especially large differences in cardiovascular disease, hypertension, diabetes, and cancer. And they have a good explanation for that the biological rationale for this may be greater oxidant stress for men, compensation of X chromosome, length of differences in telomeres, and superior function of the immune system in women, and a protective effect of estrogen against various diseases in women. Identifying the reasons for the differences in average lifespan between men and women. Very interesting. However, is the first step to improving male health, and such research must account for various differences that cannot be explained by only genetic factors. They did say biological differences, such as higher risk occupations among males, should be taken into consideration. And furthermore, men have specific lifestyles, such as the penchant to is resist changing unhealthy behaviors. And I'm sure that some of you will agree with this. And a lower likelihood of seeking medical care. There's this systematic and continuous effort to analyze and improve these factors that could potentially establish a sound basis for men's health as a distinct specialty. And there's also research about the differences in the utilization of medical resources by sex. And it has been established that males are less likely to seek medical assistance for managing their health. And we talked about it during my interview with Sir Jerry and Sir Michael. And this authors here for this article that I reviewed, they also said that male also less likely to follow medical prescriptions and sometimes refuse long-term therapy. Since American males typically visit the doctor or wellness centers to a limited extent, they often do not receive consultations involving general health tests and preventative therapy. However, the research shows that it has been shown that men are more likely to disregard pathological conditions and pain, and they are more likely to delay medical therapy because of that. And male also are more sensitive to diseases with higher prevalence, such as more of baldness, yung mga yung mga kalalakihan na nakakalbo na, at saka impotence and injuries, and that they are then they are to chronic diseases. So ibig sabihin, ang mga kalalakihan, they will only go to the doctor for consultation kung nakakalbo na sila, o kaya yung impotence na, related to erectile dysfunction, right? At pagka may injuries lang. Pero male are less likely to go and get checked for chronic diseases that can seriously affect their health, and more likely to visit the hospital from the former type of conditions than for the latter type. So, ibig sabihin, ang mga kalalakihan, mas madali silang pumunta sa doktor para pagtingin ng kanilang mga injuries at saka yung pag nakakalbo na sila o kaya yung mahina na ang kanilang performance in general. So the research shows that a general health test is recommended for men suffering from impotence. So impotence, if you don't already know, is known to be a preliminary or warning symptom for cardiovascular disease. And males with impotence have an increased 10-year risk for cardiovascular disease equivalent to that of male smokers or men with a family history of cardiovascular disease. And also, they mention also the researchers that urologists, those doctors who are specializing in urology, may play a very important role in managing male health. And as we continue on in my research, a tendency for men to visit healthcare providers less frequently than women has been observed worldwide. Hindi lang sa specific na race, kundi the whole worldwide globally, and maybe due to several causes. And they also mentioned that women who are sick generally have a stronger desire to seek treatment and a higher interest in disease prevention than men. So due to stereotypical perceptions of masculinity, yung macho-macho, yung image ng macho ng men are often hesitant to visit healthcare providers. And according to such stereotype, the foundation of manhood is physical strength. Kailangan yung malakas sila, pakita nilang malakas sila. And also self-confidence. That's why, they are less likely to seek help when they are depressed, and also emotional control. So according to a survey performed in the United States, fewer men seek help from medical experts for depression, drug abuse, physical disorders, psychological stress than women. Men also visit healthcare providers less frequently and are more likely to do so for physical issues, as I mentioned earlier, and then for emotional or mental problems. So this is something that our healthcare providers needs to look into and find ways how we can change this behavior among men. It also talk about that that men visit healthcare providers less frequently and when more likely for physical issues, again I mentioned, than for emotional and mental problems. And also the researchers found out that women tend to see doctors, nurses, social volunteers, and psychologists for health problems more frequently than men. And it can be attributed due to the stereotyping of men to be strong, they are macho. So whereas men visit emergency rooms for accidents more frequently than women. So even in cases of disease, men tend to ignore their symptoms and wait for the symptoms to resolve naturally. So I think this information is really good for everyone, not only for healthcare providers, to better understand your partner, mga kalalakihan sa ating family, the men in our family. And this tendency may be interpreted as reflecting stereotypes about, again, masculinity. And many studies have suggested that a traditional view of manhood and associated beliefs may be responsible for the lower utilization of medical resources, with the consequence that men are disadvantaged in terms of healthcare. However, according to my research, there's no studies that have attempted to explain how men with such views about masculinity would decide to receive medical services when they are actually sick. So it's a matter of us understanding where our men are coming from. So therefore, an effective explanation for why men visit healthcare providers less frequently has yet to be proposed. So there's also, I mentioned earlier that maybe the urologists are the best people to do general tests. I think that preventative, because some men who have cancer are found out to have cancer when they are already in the last stage, in the stage 4. So they're looking at the function of the urologist as the family doctor for men's health. Makes sense. It makes logical sense for me. And to continue on with the research that I found, men frequently visit hospitals for diseases related to impotence. It's a repetitive of what I had mentioned earlier, impotence and other male-specific conditions. And in light of this, I think urologists play an important role in the early detection of chronic diseases, and they are able to help males prevent these diseases. And also, urologists will play a role for men analogous to that played by gynecologists for women. So I think this comparison, like for women, gynecologists would be good to do some general health tests, and for male would be the urologist. Urologists also, there's many aspects of the function of physicians in the male health that can be duplicated across specialties, and these limitations may be encountered in professional treatment options for chronic diseases. So, screening males with urological diseases is important to identify commonly associated diseases such as diabetes, hyperlipidemia, when your lipids are very high. A lot of Filipinos have high lipids and high cholesterol and even high blood pressure, right? Hypertension. This can be accomplished by performing not only basic physical examinations. It should include also general interviews, measurements of height, weight, waistline, and blood pressure. In addition, also performing basic lab tests for blood sugar, blood cholesterol levels in patients with impotence and symptoms of lower urinary tract disease. In order to diagnose comorbidities associated with urological conditions, consultation with the relevant department is necessary, but it is nonetheless necessary to suggest lifestyle improvement. Again, back to the basics, right? Dietary changes, implementing an exercise regimen in cases involving pre-chronic diseases or patients at a high risk of chronic diseases, especially those who have family history of diabetes, family history of cancer, family history of high blood pressure, and high cholesterol. Chronic diseases can be prevented with these efforts. And again, urologists must play the role of the family doctor for men's health in general. So if you are just joining us, I am talking about men's health since the month of June 2022, every year is Men's Health Awareness Month. So I'm talking about the urologists, the doctors who are specializing in urology, and they really must play the role of the family doctor for men's health in general, rather than being limited to the treatment of urological diseases. And this role may provide opportunities to expand the duties of urologists and associated disciplinary boundaries. A basic medical knowledge of chronic diseases is required for this new function. And improvements in male health can be accomplished by interviewing and advising male patients regarding major health problems. Again, back to the basics, mga kalalakihan, our male family, regular exercise reduces the prevalence of chronic diseases such as cardiovascular disease, hypertension, diabetes, and hyperlipidemia, in addition to malignant tumors. And exercise is also known to improve prognosis of cardiovascular disease. Again, back to the basics again, a healthy diet is important, and the rapidly increasing evidence of obesity in recent years has been fueled by the consumption of a large number of calories. I guess, the food is readily available. Just go to the drive-through. A lot of grocery stores now have what they call a food court where you have a variety of choices of food. And so obesity is very rampant here in the United States. And obesity causes diabetes, hypertension, increased risk for cancer, hyperlipidemia, and significantly decreases the quality of life by increasing the frequency of backaches. When you gain weight, you have more backaches, lower leg swelling, and joint diseases because of the weight. And since obese patients with excessive food intake may still have a shortage of some essential nutrients, a healthy diet must include balanced nutrients and 3 regular meals a day. The intake of fruits, vegetables, and grains should also increase, while the consumption of saturated fats should decrease. A study suggested that individuals over 70 years of age who maintain a Mediterranean diet and a healthy lifestyle can decrease their general mortality by over 50%. It is also important to eliminate stress and to find pleasure in life with a balanced routine and appropriate rest. Consultation for sexual health are necessary, and impotence is a very high prevalence, affecting 32.4% of males between the age of 40 and 70 years. And this study was based in Korea. And the number of patients with impotence is expected to increase in connection with increased worldwide aging in the future. And since impotence is a premonitory symptom of cardiovascular disease, the early diagnosis of associated diseases could increase the effect of therapy. In addition to the benefits of the initial diagnosis and therapy for sexual health. And the risk for hypertension increases with age, and hypertension leads to many other diseases such as cardiovascular disease, a cerebral infarction or stroke, peripheral vascular disease, renal failure, and retinal abnormalities with your eyes. Although hypertension can be prevented or controlled with medication, only a fraction of patients continue with therapy, which is really a major problem for men's health. And hypertension can also be prevented by a controlled lifestyle changes. The consumption of foods with high potassium contents, such as fruits and vegetables like bananas is high in potassium, and green leafy vegetables, as well as aerobic exercise lasting over 30 minutes. And you have to perform 4 to 5 times a week. And these are beneficial due to the corresponding reduction of salt consumption and body weight. And jumping into diabetes, the prevalence of type 2 diabetes is rapidly increasing due to the increased average lifespan, sometimes insufficient exercise, and increased prevalence of obesity. The diabetes can also affect the entire body negatively, causing retinal disease, kidney disease, neural damage. Those who have already been told they have diabetes and have tingling in the tip of their fingers, you have to see your doctor. It means that your nerves are getting affected now. That's the neural damage. Another thing is the diabetes can also reduce the average lifespan. And controlling blood sugar levels is really essential for reducing diabetic complications, and therefore, again, a healthy diet, regular aerobic exercise, and abstinence from smoking and alcohol are necessary. Hyperlipidemia, when your lipids are high, too much fats in the body, it is very common in adult males. And the frequency of coronary artery disease, arterial disease increases as blood cholesterol levels increase. And we'll jump right into the prostate. The prostate is a problem in every male and induces lower urinary tract symptoms as its size increases. And degenerative changes occur in the bladder with age. And lower urinary tract infections or symptoms and sexual dysfunction are independent of other associated conditions. Hence, the presence of one symptom may necessitate a test for other related conditions. The prostate cancer is the most common carcinoma in the Western males. Healthy lifestyle practices such as maintaining proper weight, healthy diet, regular exercise, and abstaining from drinking alcohol are known to be helpful in preventing prostate cancer. Jumping again to cardiovascular diseases are caused by atheromas, in which fat is deposited on the artery wall over time and which may cause hypertension. heart disease, and cerebral impaction and peripheral vascular disease. Now, the ischemic heart disease is related disease and is the most common cause of death in males and females worldwide. Ischemic heart disease occurs approximately 10 years earlier in males. So listen up, males. You are truly at a disadvantage, right? Its risk factors are meals with high levels of saturated fat, smoking, high serum cholesterol levels, and diabetes. Lifestyle improvements can reduce the risk of ischemic heart disease. Okay, so to really wrap up our talk here, ang dami ko nang nasabing mga tips para sa inyong kalalakihan or our men in our lives. So what's the directions for the development of for men's health according to the studies? The studies that have so far been published, studies on male health, contain results from only a few Western countries with relatively good public health systems. Results from developing countries and Asian countries, which actually have worse health outcomes, are very limited. So, according to the Malaysian National Health and Morbidity Survey, significantly more cases of newly diagnosed diabetes and impaired glucose tolerance occur every year among males than females. And females are screened for diabetes and impaired glucose tolerance during pregnancy. That's true, but males do not have a similar opportunity for early screening. Additionally, many males in the study that they did not know whether they have hypertension or hyperlipidemia. And so the studies and initiatives focus on sexual health and should be actively implemented in Asian countries, including Korea. The author is a Korean, so she was researching about the Korean population. The results for Western studies, though, cannot be applied to the Asian countries, and this is what they said, because of the social and cultural differences. And so they are also looking at having some systematic and long-term studies about male health in the Asian countries. And it is true that men's health is less clearly defined and engenders a lower level of social interest than women's health. And according to a study on men's health published in Australia, men have a higher mortality rate due to heart disease, shorter average lifespans, higher rates of injury from accidents, and higher suicide and alcoholism rates than women. However, caution should be exercised in interpreting the results, they said, because the studies that analyze gender-based differences tend to be interpreted as general differences between men and women. I think one of the things that I wanted to mention during tonight's episode is to remind our men that you are not invincible. If you really take better care of your car or favorite gadget than your body, you aren't alone. So according to the Men's Health Network, a lack of awareness, weak health education, and unhealthy work and personal lifestyles have caused a steady deterioration of the well-being of American men. So they just wanted to remind our men because tonight is the day after Father's Day. So we wanted to remind our men out there to take good care of yourself. Cardiovascular disease, heart health is very important. And just to remind you that heart disease comes in many forms, and all of its forms can lead to serious fatal complications if it's undetected. So the American Heart Association states that more than 1 in 3 adult men have some form of cardiovascular disease. And this is statistics. African American men account for 100,000 more cardiovascular disease deaths than Caucasian men. Stroke targets more than 3 million men, and high blood pressure is common in males under the age of 45, according to the American Heart Association. So routine checkups can help keep that heart beating. So your doctor can actually calculate your risk for cardiovascular disease based on several risk factors, including your cholesterol, as mentioned earlier, your blood pressure, and also smoking habits if you are smoking. And if you're not smoking, good for you, because that's one less risk factors for you for having a heart attack. Now, let's go into the respiratory diseases, the chronic obstructive pulmonary disease, and other respiratory diseases. Many of the respiratory diseases start with an innocent smoker's cough. So, over time, that cough can lead to life threatening conditions such as lung cancer, emphysema, or chronic obstructive pulmonary disease. And all of these conditions interfere with your ability to breathe. And according to the American Lung Association, each year, more men are diagnosed with and develop lung cancer than in years past. Again, African American men have a higher risk of dying from the disease compared to other racial or ethnic groups, while exposure to occupational hazards like asbestos increases your risk, and smoking, again, remains the leading cause of lung cancer. If you have smoked for more than 30 years, a low dose of CT scan may be prudent to screen for lung cancer. What about alcohol? There's a question, is alcohol your friend or alcohol is your foe? According to the Centers of Disease Control and Prevention, men face higher rates of alcohol-related deaths and hospitalizations than women do. And men binge drink twice as much as women. Men are prone to increased aggression and sexual assault against women. And alcohol consumption increases your risk for cancer of the mouth, throat, esophagus, liver, and colon. And alcohol also interferes with testicular function and hormone production. And this can result in impotence as mentioned earlier, and infertility. So according to the Center for Disease and Prevention, men are more likely than women to commit suicide also, and they are also more likely to have been drinking prior to doing so. So for depression and suicide, researchers at the National Institute of Mental Health estimate that at least 6 million men suffer from depressive disorders, including suicidal thoughts annually. So I hope that this episode have given you some very important information to consider. I do have one last message for you. I have a friend, his name is John, and he is going to share with you his thoughts about Father's Day.
Father's Day 2022, what does that mean to me? What comes to mind are three parts. Number one, I am a part of my father's legacy. I've had the honor of being and having his last name and all the work that he has done, setting the foundation and setting the example for myself. And then two, living in the present day, having a son of my own, carrying on that legacy of fatherhood, passing those same lessons down to my son, Jonathan. And number three is the hope that my own son can experience the joys of being a father himself. So the convergence of past, present, and future is what matters to me on this Father's Day 2022.
Thank you very much, John, for that excellent message. Wow, past, present, and future. That's really great. So thank you so much for that message to our listeners out there. And I hope that you have picked up a few tips and information to keep yourself healthy in celebration of Men's Health Awareness Month, and also celebration post Father's Day. That was yesterday. So I hope that you will continue on taking good care of yourselves and being able to share what you learned tonight from our Healthy Mondays episode to keep yourself healthy, and those who are listening to keep your men in your life healthy. So again, time flies when we're having fun. So again, next time, I hope you will tune in again next Monday. We'll continue on celebrating Men's Health Awareness Month this month of June. And always remember that Healthy Mondays, that every Monday is a healthy Monday. Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.